Welcome back, everyone. We hope you had a nice nap or second round of lunch. As promised, we will reveal the motion for the next session without further ado because I am sure everyone is anticipating it. Fiona, the time is yours to shine.
Thank you, Mai. For the next motion, this House will disallow employees from accessing the mental health records of employees and job applicants. Ladies and gentlemen, hope you enjoy the debate session. We will proceed on with the debate session. Thank you.
Already here?
All right. As for opposition, are your three speakers here?
Sorry, your voice is echoing.
Hmm. One second. Test. Is it still echoing?
Yeah. Even when I talk, it's echoing as well.
Test. Is it okay now? Do you hear any echoes?
No.
All right. Excellent. Yeah. So just to confirm again, side opposition, all three speakers are here. Yeah.
Yeah, we are here.
All right. And also, is the adjudicator of the room here?
I'm here.
Okay. So with that, ladies and gentlemen, good evening. I'm pleased to welcome you to the second preliminary round of the 7th MyPSA National Pharmacy Debate Competition 2021. This debate will now come to order. Representing the government side for today's session is the team from AIMS 2, and representing the opposition team for today will be the team from Quest International University 2. As the moderator for today's session, it will be my responsibility to remind you of a few things throughout this session, which is number one, sensitive issues that would be offensive to political, religious, or ethnicities are prohibited. Number two, each debater has an allocated speech time of 5 minutes. The bell will be rung for the first time at the first minute, and for the second time at the fourth minute to indicate no longer POIs from the opposing sides. Once 5 minutes have been reached, the bell will be rung twice to indicate that the allocated speech time has come to an end. And number three, the allocated speech time for reply speeches is 3 minutes, with 1 minute giving before for preparation. No POIs will be asked during this time. All right, please stand by. Yeah, we are waiting for the timekeeper to join us. Okay, so with that, I'd like to open up this debate by inviting the Prime Minister to set up the case for the motion of today's session. This House would disallow employers from accessing the mental health records of employees and job applicants. Hear, hear.
Am I visible and audible?
Yes, you are.
A very good afternoon to the Honorable Moderator, precise timekeeper, Vice Adjudicator, respected opposition team, my loyal teammates, and member of the floor. I would like to propose today's motion, which is that this House will disallow employers from accessing the mental health records of employers and also the job applicants. We as the government team believe that this motion must stand. Before I tell you why, allow me to define today's motion in phrases and set up a scope for today's debate. I would like to bring to your attention to these phrases. The definition of motion according to the Cambridge Dictionary is disallows carries a meaning to refuse to declare a valid. Secondly, accessing means opportunity to approach to or to enter a place. Thirdly, the mental health includes emotional, psychological, and social well-being. It affects how we think, we feel, and fourthly, the records are a thing or constituting a piece of evidence about the past, especially an account kept in writing or some other permanent form. In short, our motion today is defined as to refuse the employers from approaching the mental health records about the past history of the employees and also the job applicants. In today's motion, our scope is to disallow the employers to access the mild, non-severe genetic type and past mental health records of employers and job applicants. We are not targeting the severe mental health records such as schizophrenia, as it will affect the quality of jobs. Well, continue to our team split. I'm Devasri as the Prime Minister. I will deliver my arguments from impacts from an individual perspective. And Michelle as a Deputy Prime Minister will deliver arguments from negative impacts from society and economical level perspective. And last, our government Whip Roshini will be rebutting the points and provide a brief summary of our case today. Member of the floor, my first reason we are proposing this motion today is mental health records are private. Whether you are a voluntary or involuntary patient, your mental health records are confidential. This means all information obtained in the course of your mental health services or treatment is not be shared by anyone. To support this statement, there is an act called Personal Health Information Protection Act. This act provides a comprehensive set of rules that applies to all sectors of the healthcare, including the mental health, in order to protect the privacy of personal health information. Not only that, another proof to be has the evidence is the Human Rights Code protects the employees from discrimination with respect to being fired, denied a job, or a promotion because of a mental health disability. And my second point why we need to disallow the employers from accessing mental health record is to prevent the discrimination to people with mental health. Mine found out that 1 in 5 employees will not disclose stress or mental health issues to their manager for fear of being placed in first line of for redundancy. Employees are allowed to ask potential employees to disclose pre-existing mental health condition which may have implication of job performance. This implies that a past depressive episode which you have fully recovered from may not to be disclosed, but a current depressive episode should be disclosed. Employers may only ask if its employee chose whether or not to disclose their condition. Allowing employees to access their mental health records can increase the chance of discriminations toward individuals with mental issues. As a result, employees with a lack of education and awareness of the mental health topic will straight away assume people with a history of mental health issues will be unable to work efficiently. This is devastating as just because who is having a normal mental illness or having mental illness in the past such as depression and stress doesn't mean they can't work efficiently with their fullest. From the point of arguments which were proven clearly appear rejected, from the point of arguments which were proven clearly with evidence, and it is very apparent that this allowing employers from accessing the mental health records employees and job applicants will make an individual feel more confident against the discrimination as I mentioned just now. Before I start again, is there any point?
Mr. Moderator, can I ask POI?
The time for POI is up.
Okay, I'll continue then. Member of the floor, we, the government team, believe that it is important for the House to propose today's motion. Therefore, today's motion must stand and we will continue to doubt till the end of the debate. With that, I rest my case. Thank you.
Thank you, Prime Minister, for your speech. Now, without further ado, I'd like to invite the Leader of Opposition to begin the case for side opposition. Hear, hear.
Am I audible?
Yes, you are.
Okay. A very good afternoon, Mr. Chairman, honorable adjudicators, respected government team, members from the floor, and my loyal teammates. This is the opposition leader from the House, and this House would allow employers from accessing the mental health records of employees and job applicants. Before I start, I would like to agree with the definition given by the government. However, we as the opposition team would like to propose to the government an Anti-Discrimination Act to prevent any discrimination issues caused by employers in this matter, instead of blatantly disallow the access of mental health records by employers. Next, I would like to rebut on the point made by the Prime Minister. The Prime Minister states that they would like to set their scope to mild mental health disorders. But the policy proposed by the government is fundamentally flawed as the main criteria for the policy remains unclear. Ladies and gentlemen, I, as the first speaker of the opposition team, will be proposing an argument on an individual and societal level about the protection of individuals with mental health conditions. Our second speaker will be talking on a society level regarding the employer being able to prepare for the employee needs and allocate their skill in a more productive manner, and as well as to increase the company productivity by improving the employee happiness. And lastly, our third speaker will rebut all points made by the government and summarize the three arguments made in this House. Ladies and gentlemen, before I begin with my first point of argument, I would like to state that this Discrimination Act that we are proposing will be able to reduce the issue of discrimination. Notice that I mentioned reduce, because discrimination is inevitable as it is a human nature according to a research by the Association for Psychological Science stating that prejudice comes from a basic need, human need, and way of thinking. So, ladies and gentlemen, I would like to propose the reason why I strongly believe that we should allow employers to access to mental health records of employees and job applicants is for the protection of individuals with mental health issues. And now, let me elaborate on an example. Someone with mental health issues might face discrimination in the society, especially in their workplace. And by allowing the access to these mental health records, the employers can determine whether the working environment itself and the office culture is suitable for the particular individual. And because a working environment and office culture that is not suitable for this individual with mental health problems will actually make their case even worse. And take for an instance, someone with an anxiety disorder happens to take up a position while climbing the career ladder is expected to not be anxious in front of a large crowd regularly. This will not only be devastating to her mental health condition, but also affect the company. And we can see from this example, this protection is not just limited to an individual level, as it extends further, of which our second speaker will address later on. We are just only touching on the tip of the iceberg of this issue, as we know discrimination is inevitable, as this has something to do with feelings, emotions of a human being. And these feelings affect the judgment of a person, and hence, when an employer decides by himself not to employ a person with past mental health issues or with current mental health issues or even with mild mental health issues, it's a blessing in disguise for that individual, as the individual will not have to work under an employer that discriminates, which will definitely worsen the condition of the mental health issues of that individual. And on the brighter side, an employer that knows what to expect and accepts this individual as an employee could provide a working environment free from such discrimination, and perhaps even provide aid which could even help in their current or past mild mental health conditions. Ladies and gentlemen, discrimination can't be eradicated, and it is our responsibility to ensure the well-being of these individuals with mental health problems and to ensure that they face minimal discrimination, if not none, from the society, especially in their workplace. And hence, this is why by disclosing a mental health records to employers can help them to understand their employees better and have an efficient assignment of tasks, which accounts to their capability to handle the stress and job given. We are not just protecting an individual, we are protecting the workforce, the economy, the society, and the country. Thank you all, and I would like to pass to the second speaker from the government team.
Thank you for your speech. Now, let's welcome the Deputy Prime Minister to continue the case for side government. Hear, hear.
Oh, am I audible?
Yes, you are.
Okay, so I will start in 3, 2, 1. A very good afternoon. I bid to the honorable moderator, timekeeper, educator, respected opposition team, my loyal teammates, and also members of the floor. Before I move on to the new arguments, I will first like to rebut the cases given by the opposition team just now. Coming to my first rebuttal, ladies and gentlemen, our dear opposition team has addressed that the severity of the mental illness is still yet to be determined. However, there are numerous tests that are ongoing, either in physicians or in normal website that we can obtain online, that they are ongoing right now, that the employers can actually see whether they are suitable to be eligible to get the job or not without even disclosing their mental illness records, which especially is very fair to someone who used to have past mental records, because as we know, everyone did their mistake, everyone has their own past, so we shall not judge anyone by their own past mistakes. And POI rejected. And so moving on to our arguments of the day now, I would like to first provide the arguments from our side as the government, which will be categorized into 2 categories. The first category will be society. We, as the government team, would like to provide a safe and fair working environment to the patients that are suffering on ongoing mild symptoms of mental illness or past illness. According to the survey that has been done by WHO, work is good for mental health, but a negative working environment can lead to physical and mental health problems. Well, mentioned by the government, the opposition team just now, that they said that without the discrimination, it can help in them to actually recover from their mental illness. However, with not disclosing the mental illness records, it can help them to overcome their mental illness furthermore, which I will elaborate in a while. Rejected. While giving a job opportunity or maintaining their job can be a way to help to curb their mental illness in the long run, there are a few main issues that will arise in the workplace if the mental health records are being disclosed to the employers. The opposition team might say that there are laws implemented to keep the confidentiality of the records that the employer shall not disclose to anyone else. However, the statistics from WHO are able to prove to you that law doesn't stop them. There are still ongoing 1 out of 3 harassment and bullying at work due to their mental health condition and have a substantial adverse impact on their own mental health that will make their mental health worse in the long run. One of the accepted.
Okay, so what are you trying to say, that is the culture and the policies are one and the same thing?
However, like I mentioned, there are the policies that say that it should not be disclosed to anyone else apart from the employer. But we all know that we are all humans. When one word is spread out, it has a very high chance possibility to spread out to others. And when I said just now, there are still 1 out of 3 ongoing harassment and bullying at work, despite there are already laws that implement that the employer should not reject it. The employer should not disclose it to anyone. And one of the bullying method is actually increased chances of gossip or unpleasant verbal reaction. Furthermore, when the employers get access to their record, they tend to have lower performances, expectation of the employee due to the stigma that they are simply giving them a chance to work, but not seeing them as a human, as a 100% well employee. They tend to put too much focus on what goes wrong at work and attribution of mistake of their mental illness. Thus, most of the time, the disclosure has to perform better than others in order to seen and treated as equal, which is exact reason why the mental health records shall not be disclosed to provide safe and fair working environment to the patients that are suffering on ongoing mild symptoms. If the workplace is happy and sufficient, it has as much as 70% high percentage of people recovering from the mental illness that they are suffering from. Coming to my second point of argument, it's the economy point of view. It can save a lot of family that has a low income from losing their job or getting a job and provide experiences to the teens. As mentioned by the Ministry of Health of Malaysia, 1 in 3 Malaysians have mental health issues, with highest prevalences among those aged 16 to 19 years, as well as from poverty, as well as those from low-income families. Low-income families are exactly the people that need cash in their hand to save them from poverty and bankruptcy. With the ongoing stigma and discrimination, they will face issues that will not be raised if the mental health records are not disclosed. Not only will it affect the family and increases social issue, it will further cause the nation to fall due to the increase of poverty rate. Furthermore, within the age of 16 to 19, it is the time for us to gain some work experiences, to gain more exposure to the public in order to let the teens to know what exactly they would like to be in the future, to be part of the citizen, to contribute for the country. If this golden opportunity is not given to them equally, how are we going to nurture the young ones to treat equally in the future? With all the supportive arguments and real statistics from which members of the floor, we as the government team hope you will stand with us with this motion today. Thank you.
Thank you, Deputy Prime Minister. Next, I'd like to pass the floor over to the Deputy Leader of Opposition to present their speech. Here.
Okay, am I audible?
Yes, you are.
Okay, 1, 2, 3. Hello, good evening to the fellow judges, as well to the government and to my fellow teammates as well. I am the second speaker for the opposition side. And before I get to my 2 points of my reason why that we need to encourage transparency between the employers and employees, I will add a few rebuttal into the government side, which is 2 things, which is the societal part and the economic part. The societal part is that the government out of sight, out of mind strategy has not worked. It has not worked as before, and it has not worked today. All right, it does not stop discrimination among the workforce, but it only seeks to encourage employees to lie in their CVs, which is only seeks to compound the problem even further, right? The block of access of mental health does not improve employment. It only seeks to promoting employers' ignorance that the mental health issue does not exist. I will have no doubt in my mind that the employee today do not even heard about schizophrenia, autism among their peers, because it's not being addressed properly and has not been tackled at the root cause. All right. And the second part is that employment, okay, which is the economy. Yes, the government has said that by lying into our CVs that we only increase employment among employees who have mental illnesses, but they have not addressed that how those employees is going to be productive in the company. A company that is less productive will only lead to a higher damage to the economy. So this is where I lead on to my first point, rejected, which is to my first point is that employers able to prepare the employees' needs and allocate their skill set in more productive manner. This is why we as an opposition agreed with this statement, because transparency helps employees to know where to allocate their resources, okay? And the first step to a solution is to first identify the problem, okay? I disagree with the government that the policy does not equals to the culture of the workforce, okay? By adopting this policy, I believe that we and the opposition and the government will agree that no culture can change overnight, okay? The policies only seeks to have the first step at the door, all right? Because let's be honest here, mental health problems have existed before we were even born. And this issue has been delayed year after year, decade after decade, century after century, but no progress has been made. And now we as an opposition, we need to ask ourselves a big question. If not today, when? By allowing employers to access the mental health record and job applicants, not only we encourage transparency between the employer-employees relationship, we also encourage employers to be more considerate to the employee's circumstances that is beyond their control, all right? And therefore, by using their strengths and weaknesses to their advantages, employees will be more productive and able to provide more resources to the company, and which have weighed their benefits over their cons.
You're right.
Yes?
As we know that nowadays there are a lot of people are trying to disclose the mental health illness. However, based on our statistics, there are still one out of three companies that are still undergoing harassment and bullying due to mental illness. So how are you going to conquer that? Thank you.
Okay, then leads me to my third point, okay? I would like to emphasize here about the karoshi culture in Japan, all right? Overwork lifestyle. Many study has correlated between overworking with less productivity, and most often not, this overworking culture have often lead to decreased productivity. The decrease of productivity often not comes from stress, depression, and most importantly, our need to adapt to the workforce. Okay, the karoshi, this mental health illness do mimic this karoshi culture, as a lot of these people are struggling in their workforce. So obviously, by allowing this lifestyle, by allowing this non-transparency happen, we only further make the employees' lifestyle in the company even worse, right? We only lead them to more depression, even more depression, more stress, because of their mental illnesses, they're unable to compete with their peers, which are day-to-day a normal people, all right? And this productivity issue will only seek to compromise because of the poor mental health and declining of manpower. Because in the karoshi culture, we also see that the death of heart attacks, strokes, and of course, suicide has been increased in Japan overnight. So as an employee, we needed to be sure that we needed to make sure that the employees' work-life balance, as well as their adapting to their environment, will be secured. So therefore, we, as the opposition, stand by our statement that transparency seeks to improve cultural workforce. Thank you.
Thank you. Now, we would like to invite the government whip to respond to the opposition case. Hear, hear.
Can you hear me?
Yes.
Good afternoon, ladies and gentlemen, our educators, loyal teammates, amazing opponents, and all members of the floor. To begin with, as the government whip, I still stand behind my team in supporting our motion for today, where this House would disallow employers from accessing the mental health records of employees and job applicants. I'll continue our case in a minute, but I would like to clear out a few things. As my first speaker has clearly mentioned, this House would only disallow mental health records of non-severe illness such as anxiety disorder, phobias, panic attacks, obsessive compulsive disorder, and so on, which is non-inclusive of severe mental health disorders, and past records of the job applicants and employees, as the non-severe ones will not be affecting them nor the job, as vice versa, if tackled in correct manner. But before that, I would like to address the clashes proposed by the opposition side and how the government team would like to address those issues better. The first speaker from the opposition side mentioned that focusing on reduced discrimination, but their second speaker asked us the question on, will our argument stop discrimination? Isn't that irony? Because their motive is to reduce discrimination, but they're doubting us on stopping discrimination. Also, the first speaker said that to protect individual mental health issue by allowing access is working environment and working culture suitable and make the case worse. But what about stigma from negative effects, which is like less opportunity and less confidence, which is cost for the employees and also job applicants. And this clearly states that mental health awareness is still not established, which is why definitely mental health records of employees and job applicants must not be allowed to access. Also, she said that why work under such employees? Not everyone is financially secure to be their own boss. Take, for example, Malaysia. 2.7 million households are still under B40 group. If a person keep on shifting and changing their jobs due to their boss, and just because they disclose their issue about mental illness, doesn't it will affect their family and also themselves? Also, the second speaker have failed to answer our question, but keep emphasizing that by disclosing the mental health records, employees and employee transparency will have better working environment. But not everyone is understanding. If that is the case, why 1/3 people in worldwide are still having mental health illness? Isn't that contraindicating? And why should we always keep seeing the negative impacts? This is to reduce the discrimination. The employer should support the employees who is suffering from mental illness. Is it really fine to fire someone who is just suffering from stress in the workplace? Organizations have a responsibility to support individuals with mental disorders in either continuing or returning to work. Many of the initiatives outlined may help individuals with mental health disorders, in particular flexible hours, job redesigning, addressing negative workplace dynamics, and supportive and confidential communication with management can help people with mental disorders continue to or return to work. As the government team, we would like to help out here rejected, help out the employers with mental health illness, as everyone deserves a chance. Also, before I end my speech, I would like to summarize on why the motion today shall stand. By disallowing mental health records of employees and job applicants to be viewed by employers, unwanted attention on the employees and job applicants can be overcome, which in a way will not destroy their confidence. As long as it is mild, they can seek for mental health societies as well as psychologists for treatment for speed recovery. However, under circumstances of severe mental health disorders, they have to undergo long-term treatments and need consideration from people surrounding them until they recover fully, which in a case they might not get from their working place. Moreover, upon human rights, privacy and confidentiality of voluntary or involuntary employees and job applicants must be kept confidential. In addition, mental health recovers must be disclosed to prevent discrimination due to mental health illness, as job applicants or employees might fear they won't be in the first line for job opportunity. Not forgetting, safe and fair working environment for employees who are suffering and ongoing mild symptoms of mental illness is vital. My last issue that I would like to highlight here is that our work is to address sorry, we, the government team, strongly believe that we are going after the right choice here. With that, I rest my case. Thank you, ladies and gentlemen.
Thank you. Now we would like to invite the opposition whip to present their speech. Here.
Am I audible, Mr. Moderator?
Yes, you are.
Thank you, Mr. Chairperson. A very good evening. I would like to wish to everyone present here today on this lovely day. The motion being debated today is the House would disallow employers from accessing the mental health records of employees and also job applicants. And we, the opposition, do not agree with the motion. I, as the third speaker, will rebut all of the points from the government and summarize my side's points. But before I come to my own arguments, let us take a look at what the Prime Minister has mentioned. The Prime Minister has mentioned that Personal Health Information Protection Act. For the information of dear government members, this act is to protect general sharing of health information, and it has exceptions when it contraindicates with other acts. For example, the Employment Act 1955 stipulates that employer is allowed to request information such as mental health records from all of the employees or job applicants without leaving out anyone, that is to avoid discrimination here, to determine the suitability of the person for the job requirements. The Prime Minister has also mentioned about discrimination concern as well. Well, ladies and gentlemen, my opposition leader has clearly mentioned that an anti-discrimination act is to be in place to counter this issue, rather than blatantly disallowing access to these records. The mechanism of this anti-discrimination act is that discrimination occurs when disciplinary action or dismissal occurs despite having the merits and talents just as an individual without mental health issues. If the mental health records of employees and job applicants are not accessible by employers, they may also face discrimination when they are working due to their mental health issues related work culture. If the employers have knowledge to this, the employers would be able to provide a suitable work environment and anticipate the different work culture from this person and accept it, which would help those that are mentally affected or having minor mental health issues as defined by the government itself. This would help a person with mental health issue to secure a stable work and grow their portfolio without discrimination while working by their co-workers who do not even know that they have mental health issues. Now, let's look at the points mentioned by the Deputy Prime Minister. The Deputy Prime Minister has mentioned that it is to provide a safe working environment for everyone. The government seems to think that every person with mental health issues is adhering to their treatment protocols. The truth is, there are those who do not follow their treatment protocols. And how do we know that they are following their treatment protocols or they are not following their treatment protocols if the employers do not have access to the mental health records? If medication is not taken properly or consultation appointments are missed, for example, if employees or job applicants that are on treatment regimen with calming agents or mood stabilizer medicines, if they do not take it, it may lead to workplace accidents or problems that can harm co-workers, patrons, or even normal people who are involved in their workplace. So how is this providing a safe working environment for everyone? How do employers are able to evaluate and ensure that the employee or job applicant are adhering to their treatment protocols if they do not have access? The employers need to recognize the stresses of the employees are under. Yes, proceed.
We clearly mentioned that we will be disclosing the severe mental disorders, but we won't be disclosing the mild disorders. So how is it that it would be affecting, causing that much until they will go and beat up or
Yeah, thank you for your
affect...
POI. You're taking very long. I'll answer your POI now. Okay. First of all, the definition given by the government is very vague when it comes to mild mental health issues and also major mental health issues. For major mental health issues, they have just mentioned of schizophrenia and so on. So schizophrenia, there are many levels, as you all know. Which level are you referring to? And for minor mental health issues, won't they develop into major mental health issues if they are not following the treatment protocol and so on? So this is something you have to think here. It's not about minor and major. Everything is important. And the employer needs to keep record so that any harmful and harmful environment can be avoided in this case. So this is why the employees need access to these records so that they can create an environment where they can even provide employee assistance programs to these employees who have these mental health issues if they know what is going on. And the Deputy Prime Minister has also mentioned that there could be leaks in the workplace of this type of information. First of all, if there is a leak and there is a non-disclosure agreement with the employee can always make a report under the penal code and take action on the employer. And the employer is also aware of this, and this is why this leak rarely occurs. However, this is only if the employee would not like others to know. If transparency is agreed on both parties, this is not an issue at all. And based on this rebuttal that I've given, this is why I think that the case presented by the government is not strong. And based on the 3 points from us, the opposition, which is protection of individuals at every level by allowing this mental health issues record to be accessed by employers, and also our second point, which is to prepare the employee needs and allocate the necessary requirement for their skill in more productive manner, and also our third point, which is to increase company productivity by improving employee happiness as well. And this is why we would like to sum that the opposition, that is us, stand in this debate that we believe the motion today is not true, and we propose the House to disagree the motion being debated today. Thank you all for your attention.
Thank you. That concludes the substantive part of this debate. Now teams are given 1 minute to prepare for the reply speeches. Now, I'd like to invite the reply speaker from side opposition to present their speech. Here.
Okay, am I audible?
Yes, you are.
Okay, hello everybody. I am the deputy leader for the opposition, and we'd like to give our response speech to the opposition. As we can see that the government has emphasized on that by blocking the access to mental health issues, that we're able to end discrimination in just one fell swoop. I don't believe so, because as was stated by our third speaker, discrimination to mental health can be also not only encountered by the law, but also be countered by the employee assistance program, which has been widely available in every employment in Malaysia. Okay, let's agree on this point. Mental health issue is here to stay, whether we like it or not. All right, and we as an opposition, we only want to emphasize about how the people with mental health issue able to boost productivity in the company. Okay, and they're able to be boost productivity if the employers know their strengths and weaknesses by allocating them based on their strengths and of course their weaknesses. Okay, are we sure do we want employers that undergo depression to work in customer relations? After all, we have seen a lot of studies shows that people with depressive behaviors have antisocial behaviors that only worsen the relationships. As you can see here, by allowing the depression to go on, it only leads to decline of the company and customer relationships. So as a result, it leads to less recurring customers, no brand loyalty, and as a result, there has no consistent income. We as an opposition, we want to address this issue, all right? And by addressing this issue, we're also able to increase employment for new sets of skills and ability into the workforce. For example, we also will look into human resource department that are specialized in psychological needs. So it is in our best interest for the employers and the opposition that the employer should employ staff that is majoring in psychology as well. Mental health issues should not be just carried out by the government and healthcare providers. I believe this responsibility should also expand to the employer as well. Let's be realistic here. Less productive employee will be laid off of their work. Okay, it is not a matter of discrimination, it's a matter of productivity. And the government only look at the employment rate, but they have not looked into employment retention. So we as opposition, we're looking at a long-term stance for both the financial security of the employment as well as the employees' company productivity as well. So we as an opposition, we take a firm stance that yes, transparency between the employers and employees regarding the mental health issue should stay on. Thank you very much.
Thank you. And now to conclude today's debate, I'd like to invite the reply speaker from side government. Here.
Oh, am I audible?
Yes, you are.
All right, so I will start in 3, 2, 1. Hello, ladies and gentlemen. There were a lot of fine lines drawn in today's debate, and in my reply speech, I would like to summarize both sides' cases, and I will tell our team differences with the opposition team. Let us cut to the chase. The motion clearly states that this House would disallow employers from accessing the mental health records of employers and job applicants, and we have narrowed it down and including past mental health records of employers and job applicants, but the opposition team has not addressed that directly, and they are only focusing on the ongoing mental illness. First of all, let's see what the opposition team trying to say. They say that discrimination can be reduced due to a happy workplace, but they only emphasize in not working for those companies that are not discriminating them, but they have not mentioned any statistic about ongoing non-discriminative company that would protect the patients that have met the records. The opposition team clearly made an assumption. However, we have successfully proved that the statistic ongoing discrimination companies and provide a safe environmental by preventing them to know about their past illness. Certain mental issues, especially those that are mild, do not need to visit hospital. So why does mental health records determine whether they are able to work? They are still going to access them with other test methods, but not to look back to their past records and still be able to put them to their suitable jobs, such as customer service. They used to claim that policy does not equal to culture and no culture can be changed overnight. Yes, we do agree that the culture cannot change overnight, and maybe it will never be changed. And they talk about the anti-discriminative policy and they are going to curb it. However, let's look at the case in US right now. There are still people discriminating Asians, murder them with their bare hands, despite decades of idea going against discrimination. People with mental illness have already suffered in their head. Are you ready to let them suffer more? They even claim that decrease of productivity that causes them to struggle in their workforce. However, this is exactly what we are trying to say. If one used to have past mental health records, but have already recovered from it, wouldn't the workforce judge them based on their past records, which causes them to put them back into the risk of having mental illness again? How is that a happy place that the opposition team claims when they are trying to tell us that it exists, but they never prove it? With no statistic and data provided, overall, their points are all based on assumption. Moving on to our side, the government team kept on giving realistic statements and factual evidence to support today's motion. Our first speaker has successfully mentioned that how mental health records should be kept private and confidential as it protects the employees from discrimination. And moving on to our second speaker, she has mentioned that by not disclosing mental health, it can provide a safe and fair working environment to the patient. Despite the laws that are implemented, humans tend to spread words and news, causing the working environment to be in a very toxic state, full of discrimination and stigma. Lastly, it can save a lot of families that have low income from losing their job or getting a job and provide job experiences to the new teens, which pushing the nation to a more wealthy condition together without discrimination. We as the government team were chosen by the people to lead. Therefore, we wouldn't jeopardize the chance given to us. So we as the government team would believe that today's motion should stand. Thank you.
Ladies and gentlemen, with that, we have reached the end of the debate session. We hope you had an excellent time watching the speakers and we'd like to sincerely thank you for tuning in. The results as well as the feedback will be announced shortly, so please stay tuned. Thank you very much.
Hello everyone, it is great to see everyone again. Now, I don't know about you, but I really feel like expressing myself just like the debaters. It still feels like a long lived dream for me. I don't know if I can ever reach the stage where you can literally convey your opinions with absolute perfection.
I think you're doing just that right now with the MCA.
I'm just referring to the script.
Well, let's just imagine the script is invisible.
Well, if I do that, I won't be able to talk in front of the camera so fluently.
I know how you feel too, Fiona. I too would like to speak with fluency and confidence like how the debaters did. Anyways, let's get that out of the way. I am sure the audience is hungry, so let us proceed on with the last sessions without any further ado. Fiona, do you want to introduce or would you like me to?
You can do the job.
I will do it then. For the next motions, this House believes that when doctors discover a patient has a sexually transmitted infections, they should reveal that info to the patient's partner. Ladies and gentlemen, we hope you will enjoy the session later. We will proceed on with the debate session. Thank you.
from side opposition present?
Yes.
Is the adjudicator for the room present?
Yes.
Okay, before we begin, the adjudicator has requested, if possible, can the timekeeper kindly write down the time in minutes and seconds, maybe in the chat at the end of each speaker's round for record purposes? Thank you very much. So with that, ladies and gentlemen, good evening. I'm pleased to welcome you to the second preliminary round of the 7th MyPSA National Pharmacy Debate Competition 2021. This debate will now come to order. Representing the government side for today's session is the team from Quest International University 1, and representing the opposition bench will be the team from UniKL 1. As the moderator for today's session, it will be my responsibility to remind you of a few things to keep in mind throughout the duration of this debate. Number 1, sensitive issues that would be offensive to political, religious, or ethnicities are prohibited. Number 2, each debater has an allocated speech time of 5 minutes. The bell will be rung for the first time at the first minute, and for the second time at the fourth minute to indicate that POIs will no longer be accepted. Once 5 minutes have been reached, the bell will be rung twice to indicate that the allocated speech time has come to an end. Number 3, the allocated time for reply speeches are 3 minutes, with 1 minute being given ahead for preparation. No POIs will be asked during this time. With that, to open up the floor for today's debate, I'd like to invite the Prime Minister to open up the case for side government for the motion. This House believes that when doctors discover a patient has a sexually transmitted infection, example herpes and HIV, they should reveal that information to the patient's partner. Hear, hear.
Okay, so very good evening to the Honorable Adjudicator, precise timekeeper, members of the opposition team, and my fellow teammates. This is the Prime Minister of the House, and this House believes that when doctors discover a patient has sexually transmitted infection, they should reveal that info to the patient's partner or partners. Before proceeding, I will declare the definition of this motion and outline the remaining arguments. The term sexually transmitted infection, also known as STIs, are commonly called sexually transmitted diseases, also known as STDs. An STI is an infection passed from one person to another through sexual contact, where the bacteria, viruses, or parasites that causes these STIs may pass through blood, semen, vagina, or other bodily fluids. Sometimes these infections can also be transmitted non-sexually, that is from mothers to their infants during pregnancy or childbirth, or throughout blood transfusion or shared needles. Some examples of STIs include chlamydia, genital herpes, hepatitis B, and human immunodeficiency virus known as HIV. Next, the information to be disclosed is the diagnosis and necessary treatment required by the patient. Therefore, what we from the government team are trying to say is that when doctors find out through tests that a patient has STIs, they should disclose this information to the patient's partner or partners for their own safety. So ladies and gentlemen, I as the first speaker and the Prime Minister of the government team would be proposing an argument regarding enhancing safety of patients. Our second speaker will be proposing an argument on reduction of transmission and the main routes of STIs, and our third speaker will rebut all points from the opposition team and sum up our team case. So, we from the government team strongly agree to the motion that this House believes that when doctors discover a patient that has sexually transmitted infection, STIs, they should reveal this information to the patient's partner or partners, because doctors are obliged to protect and enhance the safety of the people. So basically, people, they get infected with STIs when they have intercourse with someone who has STI, and once they're infected, they might infect someone else. And this is a continuous endless cycle of STIs. Therefore, when a doctor discovers that their patient has STIs, and it is necessary for them to reveal this information to the patient's partner or partners, because in this case, public health is at risk, as a third party may somehow be harmed. And in regards to that, the harm sustained by the third party may outweigh the duty of confidentiality owned by the doctor to the patient. In addition, by disclosing this information to the patient's partner or partners, both the patient and the partner could undergo pre- and post-counseling before and after treatments. And this is crucial as based on the report of London's Women's Centre's report 2017, many STIs carry no symptoms, and for this reason, The majority of people often do not realize that they've been infected, especially the patient's partner. If left untreated, several STIs can actually cause health issues such as infertility in women. Therefore, counseling conducted by doctors can improve patients' ability to recognize these symptoms of STIs and also increase the likelihood that they will seek care or encourage a sexual partner to do so. And at the end of the day, this could control the stigmatization around STIs and break the barriers to greater and more effective use of these interventions. Besides that, some people actually hope to intentionally infect their partners with STIs in order to keep them in a relationship. This is a type of domestic abuse, and anyone who tries this is not someone you should be involved with. And at the same time, if doctors were to play a part in this, indirectly they are taking part in this crime. Confiding that info that a patient is infected with STIs between just a doctor and a patient just beats the main role of a doctor. They are not supposed to protect one person and put everyone else at risk. You see, if there's a public health concern that a person is engaging in a risky behavior without concerning of others' well-being and at the same time is directly harming the other person, should this individual actually have right to confidentiality? For example, let's look at the scenario. If a man is well aware that after being tested, he's positive of chlamydia, and his partner or partners have not been informed by himself and also the doctors, should his right to confidentiality actually protect him from having to tell his sexual partners? No, because this only poses threats to his partner or partners, especially because women infected with chlamydia are 5 times more likely to acquire HIV if exposed, and chlamydia has potentially serious long-term consequences as stated before, such as infertility and also pneumonia in infants. Therefore, this harm can be prevented if both the patients and partners are informed, treated, and also counseled to practice safe sex. Therefore, in conclusion, honorable adjudicators, precise timekeeper, members of the opposition team, and my fellow teammates, we from the government team strongly stand by a statement that this House believes that when doctors discover a patient has sexually transmitted infection, they should reveal this info to the patient's partner. Thank you.
Thank you, Prime Minister, for your speech. Without further ado, I'd like to invite the Leader of Opposition to respond to their case. Here.
Hello, before that, may I ask, am I audible?
Yes, you are.
Okay. Assalamualaikum and a very good day to the Honorable Adjudicator, Precise Timekeeper, the respected opponents from the government team, Malayo comrades, and not to forget the members of the floor. For today's debate, we as the opposition team strongly disagree with today's motion. This House believes that when doctors discover a patient has a sexually transmitted infection, they should reveal that info to the patient's partners, simply because revealing such information would jeopardize doctors' integrity and patients' privacy. Ladies and gentlemen, for today's debate, I will have 2 tasks. First, I will rebut all the problematic ideas coming from the Prime Minister, and second, I will provide my argument. Now, let us move on to my rebuttal first. So the Prime Minister just now stated that the condition for what kind of information that they want to disclose and when. And she stated that they want to reveal the information like diagnosis and also immediately after the doctor find out. However, I found this is really unconvincing because of what? Because they didn't state a full condition, such as what is the criteria of partner. As we know, how can the doctor ensure that the partner is certified wife by law, or maybe their partner can also be the girlfriend, isn't it? And how they want to reveal the information? Is it in a personal space specified for them? The government failed to state this kind of condition. They only state that the diagnosis. And what is the purpose they want to reveal such information? And also, moving on to the reason, ladies and gentlemen, the government also failed to provide the reason for today's motion. So as the good leader of opposition team, I have come up with one main reason why that should be considered for today's debate. First, because to prevent the diseases, and at the same time, will also protect all the parties. And at the end of today's debate, we believe that we will be able to achieve to protect all parties in terms of confidentiality and privacy, doctors' integrity, and consequences. Hence, we need the government to prove to us how can government prove that all parties can be protected without jeopardizing doctors' integrity. Ladies and gentlemen, with the definition, I agree with the definition brought by the Prime Minister. And what we want into this debate that we want to prevent the diseases, and at the same time, we also want to protect all the parties. That's why in our work, we disagree with today's motion. Moving on to my team structure, as the opposition leader, I will provide a solid argument. Under keyword confidentiality and privacy, my deputy leader opposition will rebut the cases from the government side and present her two arguments under keyword doctor's integrity and consequences, and my opposition whipper will rebut all the problematic idea and summarize the case. Now, let us move on to my argument, which is confidentiality and privacy. Ladies and gentlemen, confidentiality means that in healthcare, it refers to the obligation of professionals who have access to patients' record or communication to hold the information in confidence, while privacy is viewed as the right of the individual client or patient to be let alone and to make decisions about how personal information is shared. We acknowledge that government want to prevent the disease from spreading, and also we are not neglecting it. What matters the most is that the doctor should respect patients' confidentiality and privacy if they found their patients to have STI. Plus, doctors should stay to their principle when they take Hippocratic oath, which is one of the content is to respect the patient's privacy. And I believe if they disclose this kind of information to the patient, doesn't this show that they are not holding to their principle? Right. Plus, in Malaysia, we also have guidelines to protect the patient's confidentiality. And according to the first principle in the confidentiality guidelines published by the Malaysian Medical Council, MMC, the patients have the right to expect that there will be no disclosure of any personal information which is obtained during the course of practitioners' professional duties unless they give consent. And any doctor who ignores this principle will be subject to this disciplinary proceeding conducted by the MMC itself under the Section 30 of the Medical Act 1971 states that, example, like their license will lose, and also they will be ordering the name of such registered person to be suspended. Ladies and gentlemen, this shows that that patient's confidentiality and privacy is very important. That's why, ladies and gentlemen, in our world, we not only want to prevent the disease, but we also want to protect the patient's privacy. So that's why into this motion, we are strongly disagree to this motion, simply because revealing such information would jeopardize doctor's integrity and patient's privacy. With that, I raise my case and I'm proud to oppose. Thank you.
Thank you, Leader of Opposition, for your speech. Now, to continue the case for side government, let's welcome the Deputy Prime Minister. Hear, hear.
Hello, am I audible?
Yes, you are.
Okay. Good evening, Mr. Chairman, honorable adjudicators, respected opposing team, members from the floor, and my loyal teammates. This is the Deputy Prime Minister of the House, and this House believes that doctors should reveal information to the patient's partner when a patient is discovered with a sexually transmitted infection. Well, before going to our first argument, firstly, I would like to rebut the point stated by the opposition team, whereby the first speaker stated that this motion breaches confidentiality and patient privacy. Well, ladies and gentlemen, in this case, it is unlike mental health disorder or cancer diseases, which definitely should be kept confidential. But it is about sexually infectious diseases which can pass to any other one. Thus, the partner has the right to be informed about that information. And here we are not revealing information to the public. In fact, Malaysia has a strict laws against the sexually transmission disease. The first point of reference would be in Section 12 of the Prevention and Control of Infectious Diseases Act 1988, which stated that no person who knows or has reason to believe that he is suffering from an infectious disease shall expose other persons to the risk of infection by his presence or conduct in any public place or any other place used in common by persons. And this means that if you are discovered that you are infected, for example, HIV, you are not allowed to expose the risk of infection to the partner or to other people. Thus, by relating to this law, information revealed by the doctor to the patient's partner is definitely in line with the laws and mission as a healthcare practitioner, so that immediate medical attention can be given. Now, ladies and gentlemen, let us bring you to our first point of argument. Firstly, proper partner notification or contact tracing is an essential part of case management for sexually transmitted infections. Having said that, done correctly, it reduces persistent or recurrent infection in the index patient, identifies previously undiagnosed infection, and thus contribute to reduced transmission in the population. The effectiveness of patient referral of partners can be enhanced through the provision of written information and easy access to tests, screening, immediate treatment, and medication provided by physicians. Well, according to a systematic review on June 2014, it stated that the partner notification found that enhanced partner therapy reduced reinfection in the index case worldwide by 30% compared to simple patient referral. Rejected. With that in mind, physician referral where the healthcare worker contacts partners directly are proven to be effective and provides an important service for patients who are wary of informing partners themselves. For example, patients with HIV, partner notification should be addressed when the infection is first diagnosed and be revisited for subsequent partners. The aim is to find and treat undiagnosed, often asymptomatic infection. This helps to reduce reinfection in the index patient and new infection, as well as the spread of STIs in the community. We would like to highlight that today's motion is a method of targeted case finding that leads to early diagnosis and treatment, reduces transmission, prevents sequelae, and provides an opportunity to discuss safer sex and education to take proper precautions. Coming to our next point of arguments, today's motion is rejected. It's crucial because as healthcare professionals, we should sort out and clarify the main roots of STIs. As the Hippocratic Oath stated that a healthcare practitioner, I will assist my patient to make informed decisions, and I will practice my professional with conscience, dignity, and honesty without hiding the truth. With that, a doctor should be true and transparent with the patients and related partners by asking important clinical questions to find out the root, whether it is due to intercourse, tattoo, sharing of needle, and unsanitized body piercing equipments. Here, we would like to show you an official guideline on how to manage STI case based on Medical Journal 2014. Firstly, a doctor starts with establishing diagnosis in the index patient, followed by counseling or consultation, discuss and motivate the index patient regarding partner notification, negotiate plan for each sexual contact, and monitor the progress of patients and the related partners, which includes both physical and mental health. With these proper guidelines and laws, partner notification by doctor is considered ethical and legal. There is also an evidence suggests that most partners who are told about their exposure to HIV appreciate this information. This is based on US study published in JAMA revealed that 132 partners located, 87 stated that the health department did the right thing by telling them about the exposure, and 92% say that the health department should continue with this valuable approach done by the physicians. As a result, today's motion makes a valuable contribution to both patient care as well as sexually transmission infection control in the nation. And we, the government side, stand firm on today's motion. Thank you very much.
Thank you, Deputy Prime Minister. Next, to continue the case for side opposition, I'd like to invite the Deputy Leader of Opposition. Here.
Hello, am I audible?
Yes, you are.
All right. So give me a minute. Right, I will start now. Thank you to Mr. Chairperson. Good evening to our respected speaker, cautious timekeeper, honorable judge, and members of the floor. As the Deputy Leader of Opposition, I would like to oppose to this motion, which is this House believe that when doctors discover a patient has an STI, they should reveal the info to the patient's partner, simply because revealing such information would jeopardize doctors' integrity and patient's privacy. Before I present my arguments, let me rebut whatever flaws coming from the government team and tell you why government's weak case should be rejected in today's debate. Firstly, the Prime Minister has stated that their their aim to revealing the information is to protect and enhance safety of the patients and also the public health safety. In our world, we also want to protect the patient safety and control public health. The Prime Minister have stated that the doctor should reveal the information to the patient, to the partner first, then only they will continue with the counseling. This is the issue the oppositions are opposing today because we believe in patients' confidentiality, that doctors should let the patients tell their partner first, then only they will ask for the counseling. And patients' confidentiality should be taken care in all kind of disease and not only applied to the sexual transmitted infection. We are not proposing to spread the disease, but there is a better way other than the doctor directly tell to the patient. And the Deputy Prime Minister has stated that if the doctors are not revealing the disease to the partners, actually they are actually exposing the disease to the partner. Okay, let me tell you something, that if a patient have an STI, I believe they will take care of themselves. They will not actually spread the disease to the partner, and they acknowledge that they have the disease. And third one, when in this case, the government want to uphold their only point, which is to protect the public safety and the partner safety. But in this case, on early cases, untargeted treatment are actually focusing to the patient. What is your opinion? What is your priority? Are you actually want to protect the patient, and are you actually want to protect the partner and the public without actually taking care of the patient's confidentiality? Okay, before I move on to the argument on why we should oppose to this motion, I received one POI. Okay, let me continue with my argument.
What happened?
Yes.
Okay. What happens if the patient refuses to inform his or her partner and hiding from the truth? And who is going to bear the consequences or the risks to the population brought by STIs? Thank you.
Okay, this is why we need to understand government case and opposition cases today. We want their partners to actually receive the information from the patient first. And after they have come to the stages that the patient actually harm their partner, then only the doctor can make sure to actually both the partner can come to the counseling. First, at the point of doctor's integrity. In healthcare settings, we can define integrity as encompassing honesty, keeping one's word, and consistently adhering to the principle of professionalism. In this case, STI is one of the diseases with a lot of stigmatization. Don't you think it is the patient's responsibility to tell their partner themselves rather than the doctors, who is the professionals, interfere with the relationship and just straight away telling the partner? We can prevent the disease by letting the patient and give some time to the patient to tell their partner. The doctors did not know their patient's partner and what is their perspective and acceptance of having a partner with an STI. The partner should not receive information from the third party, which is the doctor, and they have rights to know it from the patient itself. I take one example from the current system that our Malaysian government hospital are currently implementing under the medication therapy adherence clinic. The process are actually letting the patient to reveal the information to their partner by themselves after being diagnosed with the disease. After both parties acknowledge and accept the matter, then both can come to the hospitals to receive counseling on how their partner can help with the treatment and how to live with the disease. Isn't it better for all the parties involved, and the process will be much easier and everyone will be happy? Next, I will provide points under the important, which is the consequences. Usually, the stigma coming in STI is the partner fear of what testing positive or what living with an STI looks like for dating, love, and sexual life. The consequences in doctors revealing patient information to the partner, it will affect the future relationship between the patient and their partner. Why? Because the doctors never know what actually happens to the patient's life that actually causing them to have the STI. Sometimes the partners are not educated and they might ripping off the patient's words because they think that STI will affect their long-term relationship and sexual life. Other than that, it might affect the relationship what if the patient get the STI from past relationship. For example, the patient never tell their current partner about the sexual relationship from their past partner, and the past partner transmit the disease to the patient and affecting current partner life. This can become worsened and very worrying in marriage relationship. It could affect the relationship for long term, transmit to their partner, or actually being more worse when the patient will transmit it to their child and forever. This is why actually we believe that in order to make sure that every party involved are being taken care of, they need to actually tell their partner themselves before the doctor can interfere. Hence, under these three reasons, confidentiality and privacy, doctor's integrity, and the consequences to the patient, we believe that doctors should not reveal the information after knowing their patients have STI, because revealing such information will jeopardize doctor's integrity and patient safety. With that, thank you.
Thank you, Deputy Leader of Opposition, for your speech. Moving on, now we would like to invite the government whip to respond to the case brought up by the opposition. Hear, hear.
A very good evening. Am I audible?
Yes, you are.
Okay, thank you. A very good morning to a very good evening to Chairperson, respected adjudicator, and everyone present here. I, as the third speaker of government team, would like to start off with few rebuttals on statement presented by the opposition team. The Prime Minister from the opposition team have mentioned that revealing would jeopardize patients' privacy and doctors' integrity. She did mention about the patient's partner, and we don't agree with this because partner can be anyone, and we can't stop people from having multiple intimate partner. One having intercourse doesn't mean that they're legally married. And our PM have mentioned that STI can be transmitted by means of sexual intimacy and also blood transfusion and needle. Thus, we find this is not significant to our motion today. How many issues should we ignore by bringing up Hippocratic Oath and doctor's obligation? As a pharmacy student, we do understand the epidemiology better than patient itself. By knowing, how could we say that it's not doctor's duty? Simply placing decision on patient's hand is not going to break the chain of transmission, but we are going to put more lives in danger. As a pharmacy student as well, how can we deny the impact that we might face in future if only patients' confidentiality is being prioritized? What would happen if uncontrolled spreading of disease that possibly happen due to multiple intimate partners? If the rate of infection goes beyond the control, we might be running out of therapy regime and burden our healthcare system. Worst case scenario, if the viral and bacterial face resistance to all available regime, it might potentially paralyze our whole healthcare system. The Deputy Prime Minister from opposition team have mentioned why not allow patient to inform their partner. Okay. Let's say a patient was tested with STD and he reluctantly avoid telling his partner. That would make things worse. And Deputy Prime Minister from the opposition team also mentioned about breaking relationship. What would be the point of treating one and not treating the other? And it's not beneficial for both parties, and one person get infected again from this untreated partner. If saying that doctor revealing it to the patient's partner would break the marriage, the patient's behavior of having affairs have already break the marriage. How can we expect them to be truthful about the infection that they have if they're not being truthful to their partner? Moreover, just as mentioned by our Prime Minister, STI is not only being STI is not only being transmitted by intercourse but by other means, by getting tattoo, body piercing, and also even by needle prick injury. So patients are not accused but solely victim to the situation. So the doctor's assistant in revealing it to their partner would be a better choice to avoid putting up patient in false accusation as well. Worse to come, not revealing STI earlier would place the couple in risk during their expectation of becoming pregnant. A woman with HIV positive might face a risk of increased rate of spontaneous early abortion, low birth weight babies, stillbirth, preterm labor, and preterm rupture of membrane. However, revealing this would earlier allow them to be accessible to the treatment with a combination of HIV medication like antiretroviral therapy that can prevent the transmission of HIV to the baby and protect their health and break the chain of the transmission. The opposition team have continuously denied the motion today that when doctor discover a patient has a sexually transmitted infection, doctor should reveal that info to the patient's partner, but it seems to be not convincing enough for us, as we believe the risk of sexually transmitted disease is not something petty and requires prompt action to curb it. Our Prime Minister have stated that doctors are obligated to protect people. It is not relevant to be considered going against Hippocratic Oath just because it's a confidential matter. Management of infectious disease is more crucial as it has impact to society and well-being. We government believes that it is important that the current and past sexual partners are notified and treated in order to reduce the risk of spreading of STI, and revealing doctor are not putting the patient in trouble, but it can be considered as a healthy measure to protect the society in reducing the risk of transmission to another person. In fact, the diagnosis would only share to those who are involved, hence there would be no chance of unnecessary rumor spreading that might affect his or her life. Our second speaker have mentioned that the measure would protect patient's partner. If I'm diagnosed with sexually transmitted disease and I need to reveal to my partner, but what if I decide not to reveal it to him or her to avoid unnecessary conflict? Would that be risky to my partner? Imagine if this is happening to our dear ones. It is fair to let patient take the decision whether to share or not. Thus, we government feel it's right to standardize the protocol of dealing with the STI by professionally handling it and reveal it to the patient and continuously follow up. By doctor revealing doesn't mean that they're exposing our flaws, but has been seen as a professional method of handling critical issue. We can't deny that revealing might break the relationship, as bitter it is. Losing someone that we love from the disease would be even worst case scenario. After all, when both are able to understand the disease better, preventive measures and right treatment can be provided to help them. Ladies and gentlemen, we government team are not convinced on why such a crucial information is not to be shared to her intimacy partner by doctor, as it would be more professional in handling her SCI and briefing the management of the disease. Thus, we believe when doctors discover, do I still have time? Okay, ladies and gentlemen, we the government team are not convinced on why a crucial information not to be shared to his or her intimate partner by doctor, as it would be more professional in handling STI and briefing the management of the disease. In broad perspective, the health quality of people are far more significant to be concerned than patient's privacy or doctor's obligation. In fact, this should be seen as a preventive and management method to avoid STI that is continually creeping quietly in our lives as parasites.
Order. You're out of time, yeah?
Thank you.
Thank you to the government whip for the speech. And now we would like to call upon the opposition whip to present their speech. Here.
Hello, am I audible?
Yes.
Thank you. I'll start. A very good evening to the honorable adjudicators, precise timekeeper, the moderator, our government team and the opposition team, and not to forget the members of the floor. For today's debate, we as the opposition team strongly disagree with today's motion that this house believes that when doctors discover a patient has a sexually transmitted infection, they should reveal that info to the patient's partner, simply because revealing such information would actually jeopardize doctors' integrity and patients' privacy. As the opposition whip, I will make the rebuttals and also strengthen our case from opposition side. Before I make the rebuttals, let's take a look at how the government bring the case for today. Okay, they have not clearly stated the reason and that they debate today and why their side is can be strengthened. They fail to understand today's motion. They also, the only when it comes to the third government whip, they start to say that it could be any partner. They doesn't mention the specific criteria to whom they are actually referring to. It is actually too late to be mentioned by the government whip. Next, and they fail to say that when it should be information should be informed to the patient or the patient's partner. They should actually specifically state that. So we as the opposition team has bring a better our case in our side. So the doctor should actually not reveal the information, but actually the partner itself must reveal the information first and let the partner, the patient give the time and reveal to them. Then only the doctor should give counseling, and there are also like MPEG counseling that can be done by the pharmacist also, as stated by the our second leader. Okay, so first let's take a look. They have stated that, okay, the confidentiality, the criteria, public health at risk outweigh the duty of confidentiality. The Prime Minister has mentioned about that. Okay, patients have the right to expect that there will be no disclosure of any personal information which is obtained during the course of a practitioner's professional duties, unless they are given consent. Any doctor who ignores this principle will be subject to disciplinary proceeding conducted by the MNC. Section 30 of the Medical Act 1971 states that. So we can see that the confidentiality, the PN have mentioned that it outweighs the confidentiality, but I think the confidentiality is very crucial when it comes to this case. Besides that, they say that post and pre-counseling can be done. So that is where we are trying to still emphasize on that counseling can be done. So first, let the patient take their time for themselves, because it is not easy for the partner to accept the fact, or you don't know in what kind of state the person will be to accept. So you definitely give the opportunity for the patient to take time and tell, and only it will come to the doctor. So third, they said about the consequences such as the harm of the STI itself. So as I said, we have to give time. So we actually are not neglecting the partner's safety. We must give time to the patient. Okay. Besides that, they said there's not public strict laws not allowed to risk the partner. Okay. I know there will be effects from the STIs itself. So as a professional, that is actually a professional way to approach this.
Please.
We have laws and everything. So as I mentioned and emphasized just now. And besides that, the government also going to ensure their partner not going to reveal to others. They will keep mentioning about that. But I think it is important for the actually partner, the patient, to reveal them slowly. Then only the counseling sessions such as MTech session, because it is where the doctor's integrity will be maintained. Because after being informed, then only both of them have to come for a counseling, and what kind of information and treatment can be given to the patient and also the partner as well. So that actually the pharmacist can guide them during the counseling session. So I think it is not very important to rush into this matter when giving the medical practitioner to do so. So situations that threaten the confidentiality of the physician-patient relationship are always difficult to resolve. We have argued there are limits to the physician's duty to maintain the confidentiality of physician-patient relationship, but these limits are very difficult to define. Legal and judicial precedents are not sufficient to provide concrete direction. Helpful ethical guidelines exist, but they are not extensive enough. So issues of justice and fairness may underlie this imperative, because the burdens of sexually transmitted disease falls disproportionately. With that, on opposition side, we strongly disagree with today's motion that this House believes that when doctors discover a patient has STI, they should reveal that info to the patient's partner, simply because revealing such information would jeopardize doctors' integrity and patient's privacy. With that, I end my case. Thank you.
Thank you. That concludes the substantive part of today's debate. Now teams are given 1 minute to prepare for the reply speeches. Now, I'd like to invite the reply speaker from side opposition to present the speech. Here.
Am I audible?
Yes, you are.
Okay. Wait a minute. All right, ladies and gentlemen, in our world that government did not understand, we want every party's rights are being taken care of. We understand, and we also believe in protecting public health, safety. If you believe in consent, you should believe in protecting patient confidentiality and be professional by not interfere in patient's relationship. They want to protect public safety by jeopardizing doctor integrity and patient confidentiality. They come up with safety for patient and public health, which, as I state, is also our aim, but we create a better way and a better environment for the patient to reveal the information to the partner itself. This is the issue the opposition are opposing today because we believe in patient's confidentiality and we believe that doctors should let the patients tell their partner first, then only they will ask to come for the counseling. Next, they come up with the contact tracing and partner notification and what so on. This is a lousy mechanism, coming from the government because other doctors and the government have time to find each and every partner of the patient. Wouldn't it be easier if we give the responsibility to the patient and let every patient every of their partner knows with their own way and explain it in a way that both person in the relationship understand, and just leave the professionals outside of this matter and they can counsel them and control the public health later after that. Next, they come up with doctor should be honest and told the truth to the partner and so on. I would like to oppose and so on. However, I found this is very dismissible because first, how can they track the true partner and their patients state the right information details in the form of or the system in the first place? And a good doctor must acknowledge the risks and consequences that they will face after they reveal the information. Then how can they ensure they are the true partners, or actually the patients are creating the haywire and creating not mistaken information and all that. And this is why I would like to oppose to this motion that this House believes when doctors discover a patient has an STI, they should reveal the info to the patient's partner simply because revealing such an information will jeopardize doctor's integrity and patient's privacy. Thank you.
Thank you. And now to conclude this debate, I'd like to invite the reply speaker from side government. Here.
Once again, a very good evening, ladies and gentlemen. I, the Prime Minister from the government team, would for the very last time like to do my reply speech and wrap up the debate. We strongly believe that doctors, when they discover a patient as STI, they should reveal this info to the patient's partner because it is clearly a better solution that provides more positive impacts and drawbacks to the individual and society altogether. So my speech will be divided into two parts, where the first part I will declare the flaws from the opposition team, and in the second part I will show why the government's case is much more better than the opposition's case. So if you were to look at the opposition team's framework, they would have you believe that by disclosing patients' info on them being infected with STI to the partner or partners, they keep focusing on breaking confidentiality, integrity, and privacy. But what they are not looking at is patients and partners and probably the public's health. And one more thing is, they pinpointed that time should be given to patients to disclose this info to partners and on their own. But for how long? Once the disease is uncurable or once the partners are actually in their grave. But if the opposition team were to have done proper research, they would have known that confidentiality has its own exception. That is based off the Malaysian Medical Council Revised Guidelines 2011 on confidentiality, where there is exceptions, especially when these diseases are a threat to public health. And the opposition keeps saying how their intention at the same time is to enhance the safety of the public. How are you planning to do this when you're not even allowing doctors to reveal info to one person, that is the partner itself? You can't even guarantee the safety of one person. How could you say that you prioritize the health of public, which is millions of people? If we were to go through with the opposition's framework, we're just providing free passes to everyone to have unsafe sex. Because patients with STI, they may be reinfected even after a treatment by engaging with the same sexual contacts or those who actually have not even been treated. And if the particular sexual contacts were to engage in intercourse with other people, this again is just an endless cycle. The opposition team are focusing on the little things such as privacy, integrity, and confidentiality. But I think it's time to take a step back and look at the bigger picture, that is the safety and health of everyone at risk. Now let's move on from the opposition and look at us, the promising government. We have a clear goal in mind, and our main concern is only to ensure the safety of people and basically the citizen, individually and in whole as the public itself. We can't just allow doctor to treat one patient when they have the knowledge that a number of people are also at risk and in need of treatment. It's like how we stated before, for example, COVID-19. When someone is infected with COVID virus, we disclose it to the family members and also the close contacts of the person who has been infected. And we even openly disclose it in the news because we want everyone to be aware of whether they have been in contact with this particular person or not, and they might have a risk of contracting this virus. And same goes to this scenario when doctors actually acknowledge patient's partner or partners. When the direction of emphasizing prevention rather than cure, we're actually breaking the cycle of unsafe sex, and most importantly, we are also on the route to save lives. Therefore, we believe that we from the government team have outlined the proper procedures and clearly come up with a strong alternative that could possibly help in management, treatment, or prevention together. Therefore, we from the government team strongly agree with the motion. Thank you very much.
Thank you. Ladies and gentlemen, with that, we have reached the end of this debate session. We hope you had an excellent time watching the speakers, and we'd like to also sincerely thank you for tuning in. The results as well as the feedback will be announced shortly, so stay tuned. Thank you all very much.
Welcome back, everyone. Let's talk a little about the previous session. Yes, STDs, such a taboo topic. I don't think I'm going to comment on anything yet, so please save me from this awkward scenario by saying something professional.
Honestly, I am quite an open-minded myself. But yeah, you're right. No one really likes to talk about STDs, especially if they are having one themselves.
I mean, imagine if your partner really finds out you have STDs, and you will immediately be stigmatized not only by your partner but society in whole. We tend to have this perception that people who have STDs are weird, but all of us do in a way. Do you agree?
Alright, this conversation is getting a little bit out of hand, so let me bring it back to the main topic. And let me say something funny about STDs. If you love someone, set them free. If they come back, be sure to have them checked for STDs. Oh my god, I know that was a corny joke, but yeah.
Can we just end it here? It's getting out of hand.
I was hoping you would say that. Ladies and gentlemen, we hope you have enjoyed the session for today, and that marks the end of today's debate sessions. We hope you enjoy it. Thank you for being with us. Thank you for being here with us after all those long hours.
Alright, I know what you guys are thinking. It is time for dinner, and yes, it is certainly time for dinner. So we will take a break before we come back with an online talk at 9 p.m. later.
Joining us tonight is someone who is quite famous in the pharmaceutical course internationally. So if you're free, do join us for the session later. Thank you everyone. You may take your leave.